Good morning, TLC. This is Dr. Jared Young, and I joined you this summer to find ways to improve TLC. After this, I was able to compare TLC to the Ministry of Health, and now I will share what I have found. And it's all been good news. Now, TLC provides critical services to a vulnerable population that is difficult to reach. Most people would say that your job is impossible. So how do you improve on this? How do you improve on impossible? I like to think of improvement as a destination, a trip, or a journey. But every journey needs directions or a map to see where you started, where you are now, and where you are going. You need all three to improve. But how do you know where you started? Where does TLC begin on the road to improvement? Well, you start with the basics. It's the buildings, it's the supplies, and the staff. That is your starting point. Now, the foundation of TLC are the clinics. It's where you see patients, but it's also where you eat and sleep. And according to the Ministry of Health, you have great clinics. They're clean, solar-powered, and have flush toilets. Best of all, they float, so they're located near your patients. Your team is also started with good equipment for a great journey. You bring your own basics like stethoscopes, scales, sanitizers, and needles. You bring your own ultrasound machines, and even your own medications. All of this is better than the Ministry of Health. You also start your journey with great people. You have well-trained doctors, nurses, midwives, drivers, and accountants. But most importantly, a cook. And just remember to tell them if you don't like to eat ants. Right, Chani? So that was us looking backwards. We know where we were and where you started. And it's a strong foundation with strong infrastructure, strong equipment, and strong people. So now we can look where you are today and your activities you're doing now. We ask, what have you accomplished and how well have you accomplished them? How are the clinics running? How many patients do you see? How many treatments are being given? And are the patients satisfied? Again, TLC achieved the impossible, and in 2016 saw over 25,000 patients, which is around 30 patients per day for each physician, which by the way is the average for the US and Canada. You also provided over 50,000 free prescriptions. You also conducted a large number of prenatal exams and completed a screening ultrasound for each patient. You provided 1,500 immunizations and hundreds of long-acting birth control, including implants and intrauterine devices. And there is more. You're also providing high-quality care. When patients were asked to share how they felt, they told us that TLC is easier to reach in terms of gas, cost, and time. They're also more satisfied with TLC doctors than the Ministry of Health. But on your journey to provide healthcare, there have been challenges and bumpy areas where you got stuck. There were physical problems, like vans breaking down, low water levels, and yes, the water hyacinths that obstruct the boats. But what about the things that you can change? Just like getting stuck in the shallow water plants, you can get stuck in old work habits. But which work habits are the problem? And how do you get unstuck? How do you provide better care? It's simple. Ask for directions. So what travel directions do you need and where do you get them? Well, it's an evaluation. An evaluation is like asking for directions. It helps you see where you started, where you are now, and how to move forward. And it was my job at TLC to do exactly this. My evaluation showed you your starting point with your building, your equipment, and your people, showed you where you were today, the numbers of patients you saw, the treatments given, and patient satisfaction. Now it's time to examine where you got stuck. Thankfully, there were only a few areas, and the biggest was medical records. The paper charts were difficult to transport and store, but with the implementation of a new electronic system, you will be more efficient in both transport and as well as organization. There were other areas which needed some improvement, such as clinical skills. Although TLC staff scored better than the Ministry of Health, small improvements can be made to increase the thoroughness of patient histories and physical exams. This will likely require a dedicated continuing education program. So you started with great infrastructure, equipment, and staff. You were challenged You challenged the impossible by providing a large amount of quality care. But there were areas where you got stuck and need improvement. But improvement is a journey. It's knowing where you started, where you are today, and how to address the future when you get stuck. And it's up to senior leaders like Siobhan and John and myself to help to design and implement a quality improvement program. So again, thanks TLC, and I look forward to seeing you again in the fall.